I'm Vicki Adamson in Lincoln, Nebraska. I'll be doing my internship at Lincoln Medical Education Partnership. This is a nonprofit that houses 5 smaller profits within it. For my internship, I'll be working at 2 of these nonprofits. The first one that I'll be working at is Lincoln Family Medicine Center, and the second one will be Stepping Stones for Families. Lincoln Family Medicine Center is a patient-centered medical home that trains family practice doctors to enter into private practice. So as a patient-centered medical home, they have a behavioral health department as well as, of course, their medical department. My internship my placement will be kind of in between these 2 departments. So when patients come in and the residents feel that something is kind of off, or if the patient comes in and they are in crisis, then I go in and speak to the patient, work with them, do an assessment of what's going on with them, and then recommend different interventions. And these interventions can be that they need to be further assessed by our psychologist to determine whether or not they need to go inpatient, whether or not they might need long-term outpatient, or if they're just in crisis mode at this moment and they need short-term interventions to get through the crisis. If they are in crisis mode at this moment and they need short-term intervention, I will work with those patients to get them through the crisis. I am a dual-tracked student, so I have to do individual, family, and group work as well as program development. So my crisis work will be addressing kind of the individual, and then for the other portions, I will be developing 2 new programs. One of them is a parenting education class. We have chosen a psychoeducational curriculum, so it's really kind of targeting at-risk parents for becoming involved with CPS and either trying to correct some of their parenting behaviors or just giving them some newer or alternative options for parenting so that they don't become involved. Along with this will be a little bit of family work. If there's a family that seems to be really struggling and it comes down to maybe a functioning issue, not necessarily parenting issues, then I will work with that family one-on-one to get through those functioning issues. And then the other part of what I'll be doing is developing and running an incentive program. This is for our OB patients. So as part of this program, for everyone that comes in, they can sign up for it or choose not to. And for every OB visit that they come to, they can actually earn credit. And then with that credit, they can go shop in our baby boutique for the different baby items that they might need. This is very useful because a lot of our patients are low income, some socioeconomic struggles, and so purchasing, bottles and diapers and all of those things can be a real struggle for them. So this was our way of promoting prenatal care and then also helping them out with those items that they need. Along with this program, they will also have case management by me, and then I will do an assessment with each of them and determine kind of where they are in their needs. If they are doing well, they have a great support system, they don't really need a lot of intervention, then I'll just kind of meet with them once a trimester. If there's someone that maybe is choosing abortion, maybe choosing adoption, or they are pregnant and very unhappy with it, then I will work with them on a one-on-one basis to get them through some of those feelings and emotions that they are experiencing, or get them connected with someone that maybe has a little more experience than I do if they need a little more intense work. The other part of my internship will be Stepping Stones for Families. This is a substance abuse program. With them, I will be doing more crisis management work, assessing for crisis, helping clients work through crisis, and then I will also be doing some community outreach work. So I will represent the agency at the Homeless Coalition meeting every month. This is a meeting with about 50 different agencies here in Lincoln whose goal is to reduce and try to get rid of homelessness in Lincoln. through different programs, resources, financing. There's lots of different disciplines that come to this. There are lawyers, psychologists, substance abuse counselors, advocates. I believe there's probation that comes. So it's just the opportunity to work with lots of different disciplines and kind of see how every discipline is able to work together to address a very serious, big issue. I'll also just be doing outreach with going to different agencies, trying to educate on our program, seeing if there's any way that I can offer assistance to any of them with assessing their clients if I need to. So that program is very community collaborative focused, so that's why I'll be doing a lot of going out to other agencies and working with them. So I'm kind of excited about this internship because they are very open to the learning environment. That's what they do with residents. And so they're very open to me saying, hey, I would like to try doing this, and they will do what they can to try to help me do that. So it'll be an interesting 16 weeks.